Let me discuss now the reasons used by people who do not want to use a rubber dam. First, they say it is difficult to use. It's complicated. They say patients don't like it. It's time consuming. I can't use it when I have a subgingival caries. Most of these reasons are actually non-supported by evidence. Patients don't like it because when they experience a dentist having difficulty putting a rubber dam on, of course they're not going to like it. But if the dentist is fast, quick, and do it precisely and properly, patients will accept it, especially if you tell the patient, explain to them about their conditions. So how do we convince patients, if you say they don't like it, how do we change that? You change that by stating the facts. My friends, the fact is you're dealing with bacteria from A to Z. The caries is infected. Staph aureus, staph epidermis. You have O bacteria, you have viruses, especially when you have an endodontic treatment failure. When you have an old silver point or an old leaky root canals, incomplete fillings, and you open the pulp chamber and you see discoloration and odor, this is pure infection. And these bacteria, immediately they become part of the aerosol. When we drill, it's called AGP, aerosol generating procedures, whether it's a cavity preparation or access preparation, you are producing aerosol. And this aerosol is loaded with staph, epidermis, Proteus mirabilis, fungus. It's in the infected dentin, it's in the saliva. And if you do not use a rubber dam, all of this is in the aerosol for the patients to breathe, for you to breathe, for your staff to breathe. And ask me, there was a time in my life I did not use a rubber dam. Recent graduates, huh? And I remember vividly the nose infections I had always. It was Staph aureus. Our noses are saturated with Staph aureus. So the issue is issue of safety. Biologic safety, preventing bacteria. Physical safety, the rubber dam, 90% prevent this bacterial aerosol. 90%, up to 99%. And the second safety of patient is the issue of physical harm with rotary instruments, the mucosa, the tongue, the floor of the mouth, all exposed to injury. The patient swallowing instruments, that's physical injury. The patient swallowing irrigants, that's a physical injury. The patient swallowing the bacteria from caries, swallowing post, following old restorations. When you remove amalgam without a rubber dam, mercury is now in the body. You increase the level of mercury in the patient serum. So it's an issue of safety. And we care for patient safety, yet it's a standard of care. If we look at advanced dentistry which is 200 years old, 100 years old, and the past 50 or 60, 70 years advances, modern dentistry is on evidence. And this evidence says rubber dam is the best safety tool for patient safety, staff safety, doctor safety, efficiency, and productions. And in the next series, I will talk about simplification of rubber dam use and why I use it in everyday dentistry. Thank you for listening.